I was going to quit. Not next month. Not after the shift. That day, I had written the resignation email in my drafts at 2 a.m., right there in the supply room, hands still shaking after a code blue. My badge felt heavier than ever. I hadn't slept properly in days. I hadn't smiled in weeks. I kept thinking, is this it? Is this all nursing is? Endless exhaustion, underappreciation, grief, and silence. I was a year into my job at the emergency department. Everyone warned me the first year would be hard, but this was something else. I had seen more death than birthdays that year. I had held hands that never squeezed back. I had been screamed at by patients, by families, by doctors, and worst of all, I had started feeling numb, detached, cold. And then she arrived. A 76-year-old woman, Mrs. Sophia James, brought in by ambulance for confusion and weakness. No family, no identification. Just a handwritten note in her coat pocket. My name is Sophia. Please be kind to me. She was tiny, frail, with eyes that darted like a frightened bird. Her voice was barely audible, and her grip on reality was slipping. The emergency department was slammed that day, overflowing stretchers, alarms going off, angry relatives demanding updates. Everyone was in a rush, but something about her made me pause. While the doctor reviewed her labs, I sat beside her. I offered her water, tucked in her blanket, and asked if she was in pain. She looked at me, confused. Then suddenly, she whispered, "You look like my daughter." I smiled politely, unsure what to say, but then she reached for my hand and held it tightly. "Don't leave me," she said. "It's too cold here." That moment stopped me. I stayed with her as long as I could. When I had to check on other patients, I kept coming back. I brought her socks. I adjusted her oxygen tubing gently. I brushed her hair. No heroic procedures, no drama, just presence. Later, her results came back. Severe UTI, early sepsis. She needed admission, but still no next of kin. I sat by her bed as the porter prepared for transfer. She opened her eyes again and said, "Thank you for treating me like a human. Some people just walk past." Before she left, I tucked a little note back into her coat pocket. "Please be kind to me." She squeezed my hand one more time. That time, I squeezed back. The next morning, I checked on her upstairs. She was sitting up, eating jelly, and asked me to tell her daughter if she came forgiving her. I never met the daughter. Mrs. Sophia passed 2 days later, but that moment, those hours, they stitched something back together in me. It wasn't dramatic. No code blue. No miracle, just small kindness in a sterile place. That day, I deleted the resignation email. I didn't stay in nursing because it's easy. I stayed because of people like Sophia. Because in all the chaos, one real connection can pull you out of the darkness. Because every patient is a human story on pause, waiting to be heard. And sometimes it's our voice that turns the page. Learning lessons for healthcare workers. Compassion doesn't require extra time. It lives in the small gestures, the blanket, the silence, the hand squeeze. Even when medicine can't cure, presence can heal something invisible. Never underestimate how deeply your caravan in ordinary moments can change someone's final chapter. Learning lessons for medical and nursing students. Burnout is real, but so is the reason you started this journey. Look for the small victories. Don't confuse emotional numbness with strength. True resilience means staying human. Not every shift will feel meaningful, but someone, somewhere, is waiting for the kind of care only you can give. Learning lessons for the public. Nurses are not just clinical machines, they carry emotional weight every day. Small kindnesses from patients and families mean more than you realize. Behind every uniform is a human being struggling, just like you. Closing reflection. I didn't stay in nursing because it was easy. I stayed because of moments like Sophia, reminders that even in chaos, a simple kindness can hold someone together. Not every shift brings miracles, but every patient deserves to feel human in their final movements of life. This is Silent Scrubs, where we share the unseen truths of hospital life. If this story touched you, subscribe and join me for more.